back to my channel. Today I wanted to talk about Parkinson's disease from a neuropsychological point of view. As you may already know, I did a practicum in a hospital and we were in the department of neurology, and my supervisor had a special link with a neurologist whose expertise was movement impairments, and she had a lot of Parkinson's disease patients, so in consequence we had to do yearly checkups to see their cognitive functioning. So I was able to tell patients that were at the beginning of the Parkinson's disease and more towards the end. The way they do the protocol in that hospital in particular, and I believe maybe elsewhere too, is they start with some pills that will allow them to have more dopamine. I don't want to go too much into detail, you can maybe do some online research, but basically the Parkinson's disease is a depletion of dopamine in areas of the brain, and these pills allow them to have more dopamine, but at some point in the years this treatment doesn't work anymore, so they try other treatments, and the last resource is deep brain stimulation, which is basically a brain surgery that they introduce 1 or 2 electrodes deep in the brain, as the name says, and it is controlled remotely by the neurologist, and they change the frequencies to make this patient tremor less with different variables basically. So that was more of the neurologist consequence of Parkinson's disease. But the neuropsychological part, what we do, we have a specific protocol, at least we did in that hospital, that we have to ask them to do a lot of like switching tasks, because they struggle to do those things in Parkinson's disease, to switch from one thing to another. And also some things that they had to move their fingers, like tapping intermittently. Other ones were switching from doing maybe like open the hand and close the hand, and they had to do it like this. Some of these protocols were super easy for some of them, but for the ones that were with the disease for more than 10-15 years, it was pretty hard, and you could tell once they come in the office that they were gonna struggle with that. It is also important that, I don't know if you know, but in Parkinson's disease there's a thing that is called being on or being on off. So for us as neuropsychologists, we had to make sure that the testing had to be done when they were on. That way we could be sure that they were at the best cognitive functioning that they had. And I really enjoyed this protocol because I feel like they were really involved and it was really interactive for them, compared to other protocols that we had, that it was more of a passive interaction between us and they just had to answer and not really do much. And because of their condition, they have to do some movement related procedures so we can test and see how they're doing as well cognitively. It's not only based on what they're telling us by word or like drawing, because they had to do some drawings as well. They also struggle with writing because of the tremor, and even if they don't have the tremor, sometimes they struggle as well with it. But overall, it's a really complex disease. There's no cure for it. There's only that the clinical symptoms are being treated by doctors, but sadly there's nothing that as of today has the answer of why this happens and why there's a depletion of dopamine in their brains. But to me, it is one of the most interesting diseases that I've came through during this master's that I was doing. I'm done already, and I really enjoyed having that experience to be with the patients. We were also allowed for, I think, 3 times with this neurologist, and we were in the office and she was with her patients, not only Parkinson's but other patients. And to me, it was one of the most interesting things, one of the highlights of my practicum during the masters. So that was the end of the video. Thank you so much for watching. Don't forget to subscribe, and I'll see you in the next one. Bye!